In this lecture, we will cover in detail the history of aesthetic medicine from ancient time period to modern era. We will explore how people in different eras used natural resources to enhance their beauty. The following topics will be covered in this lecture: the origins of aesthetic medicine through ancient time, beauty-enhancing techniques used in medieval and Renaissance period, aesthetic medicine in 18th and 19th century, aesthetic medicine in early 20th century, developments in aesthetic medicine field in late 20th century, modern era of aesthetic medicine 21st century. Ancient origins of aesthetic medicine. Beauty-enhancing practices by ancient Egyptians. Beauty was highly valued in ancient Egyptian society and was often associated with health, fertility, and spirituality. Both men and women took great care in their appearance, as they believed it pleased the gods and helped them in the afterlife. Use of cosmetics and elaborate hairstyles was common among the elite to display wealth and social status. Pharaohs and nobility often set beauty trends, which were emulated by the general populace. Use of kohl. Kohl is made from galena. It was used by ancient Egyptians to line the eyes to enhance the cosmetic appearance and as protector to protect the eyes against sun glare and infections. Use of red ochre and malachite. Red ochre was used by ancient Egyptians as a cheek and lip stain, while they used crushed malachite for green eyeshadow and crushed ochre for reddish eyeshadow. It was believed to have protective properties as well. Ancient Egyptians used henna as means of decorating and coloring their hair and nails to make themselves more beautiful and attractive. They used it for body art, often in intricate patterns for special occasions. They used many different colors of henna on different occasions. Milk baths and exfoliation. A mixture of aloe, myrrh, and frankincense was used by ancient Egyptians as an anti-wrinkle cream. It was believed to have anti-inflammatory properties that kept the skin free from blemishes and acne. They used facial masks made from honey and milk to purify the skin. Milk bath is possibly one of the most famous ancient Egyptian beauty secret for skincare treatment. It is believed that Cleopatra herself bathed in sour donkey's milk, as the lactic acid could exfoliate and rejuvenate the skin. Aesthetic practices in ancient Greece and Rome. Enhancing the beauty through aesthetic techniques was a significant aspect of life in ancient Greece and Rome. These civilizations had a profound appreciation for beauty and perfection, which extended into their medical practices. While their techniques were rudimentary compared to modern standards, they laid the groundwork for contemporary aesthetic medicine. In both ancient Greece and Rome, beauty was highly valued, and physical appearance was closely associated with social status, health, and moral virtue. For instance, the Greeks believed in the concept of kalokagathia, which means combining physical beauty and moral virtue. Similarly, the Romans, who were influenced by Greek culture, also placed a high emphasis on appearance, associating beauty with power and success. Ancient Greeks used different methods to enhance their beauty. For instance, they used olive oil, honey, and beeswax for skincare. These substances were believed to cleanse, moisturize, and protect the skin from the harsh Mediterranean sun. As cosmetic practice, Greek women used ceruse, a white lead used in that time as skin whitener. This practice was considered as a symbol of aesthetic and social status. They also used rouge made from red ochre for their cheeks and kohl for their eyes. Another important factor in Greek beauty routine was bathing. It was considered a ritual by them. Bathing was a crucial part of Greek hygiene and beauty routines. Public baths were common in that era. These baths were known as gymnasia and palaestrae. Individuals would clean their bodies and exfoliate using abrasive materials like pumice stones in these baths. Also, The ancient Greeks used to remove their hair as part of beauty practice. They used various methods such as plucking with tweezers, shaving, and using depilatory creams made from natural ingredients like resin and honey for removing hair. Physical fitness was a crucial beauty factor in that time. It was synonymous with beauty in ancient Greece. The Greeks engaged in athletic activities, not just for health, but to sculpt their bodies. The ideal male body was muscular and lean. Romans were very concerned about their appearance. They took great care of their physical appearance. Romans inherited some beauty practices from Greeks and developed many techniques by themselves. They inherited the Greek tradition of bathing, but took it to another level with their elaborate public bathhouses, which they called thermae. These baths included hot baths, warm baths, and cold baths, which were used to cleanse and rejuvenate the skin. Romans also inherited some cosmetic substances from Greeks. For example, Roman women used similar cosmetics as the Greeks, including white lead for skin lightening, rouge for cheeks, and kohl for eyes. They also used wine and barley for facial masks to rejuvenate the skin. Romans took great care of their hair, often using elaborate hairstyles to signify social status. Women used hair dyes made from plant and animal sources to achieve the desired hair color, and wigs made from the hair of slaves were also popular. Romans used similar techniques for hair removal as Greeks, which includes the use of razors, pumice stones, and depilatory creams. The Romans were fond of perfumes. Perfumes were widely used in ancient Rome, made from flowers, herbs, and spices. They were applied to the body and hair and used to scent clothing and homes. Perfume making was an art, and high-quality perfumes were a sign of wealth and sophistication. In physical fitness, they followed Greeks. The Romans valued a lot physical fitness. Public baths often had attached gymnasia where men could exercise. The ideal body was muscular and fit, reflecting the virtues of strength and discipline. The Romans also practiced different medical and surgical procedures. While these procedures' primary focus was on treating injuries and diseases, but some surgical practices had aesthetic purposes. For instance, the removal of scars and moles was common. The Roman physician Aulus Cornelius Celsus wrote about techniques to remove scars surgically. Romans developed different techniques to treat skin conditions like acne and warts were treated using various natural remedies. For example, Hippocrates, the father of medicine, recommended treatments for skin conditions using ingredients like vinegar, honey, and herbs. During the medieval and Renaissance periods, aesthetic practices were influenced by both religious beliefs and a revival of classical ideals. In the medieval era, beauty practices were minimal due to religious constraints. Herbal remedies and simple cosmetics were used discreetly. The church's teachings often dictated modesty, leading to a more restrained approach to beauty. However, herbal remedies were still popular for skincare, and women used simple cosmetics like rose water and ground roots to enhance their appearance subtly. The Renaissance, marked by a renewed interest in human anatomy, led to advancements in surgical techniques for aesthetic purposes. Beauty became more celebrated, with a focus on symmetry, pale skin, and vibrant hair, reflecting the era's admiration for classical antiquity. Women of the upper class used white lead-based powders to achieve a porcelain complexion, a sign of nobility and wealth, despite the toxic risks. Hair was often lightened using concoctions made from lemon juice and sunlight, and elaborate hairstyles adorned with pearls and jewels became fashionable. The Renaissance also witnessed advancements in surgical techniques such as early forms of rhinoplasty and scar revision as the study of human anatomy progressed. This period laid the groundwork for modern aesthetic medicine, blending artistry with emerging medical knowledge. In the 18th and 19th centuries, aesthetic medicine practices evolved alongside societal changes with the significant scientific advancements and growing emphasis on personal appearance. The 18th century, particularly in Europe, was characterized by the aristocracy's obsession with elaborate beauty rituals. Women and men of the upper classes wore powdered wigs, applied heavy white lead-based face powders to achieve a pale complexion, and used rouge made from crushed carmine beetles to add color to their cheeks. The use of mousse, a small fabric patches applied to the face, was also popular to cover blemishes and convey different social messages. As medical science progressed into the 19th century, there was a shift towards more scientific approaches to skincare and cosmetic enhancements. Cold creams, often made with beeswax, rosewater, and almond oil, became widely available and were used to moisturize and protect the skin. The century also saw the development of the first rudimentary forms of cosmetic surgery. For example, rhinoplasty procedures, initially developed for reconstructive purposes, began to be used for cosmetic enhancements as well. Hair removal techniques also advanced, with early depilatory creams and waxes gaining popularity. The use of corsets to shape the body can also be seen as an aesthetic treatment aimed at achieving an idealized body shape. By the late 19th century, the groundwork for modern aesthetic medicine had been laid as surgical techniques improved, and an increasing number of products aimed at enhancing appearance became available to a broader segment of society. The early 20th century marked a pivotal period in the development of aesthetic medicine, characterized by significant advancements in surgical techniques and the emergence of modern cosmetic procedures. This era was heavily influenced by the aftermath of World War I, where the need for reconstructive surgery for injured soldiers led to groundbreaking developments in plastic surgery. Pioneers like Sir Harold Gillies and Dr. Archibald McIndoe refined techniques for facial reconstruction, particularly for treating severe facial injuries and burns. These innovations laid the foundation for modern aesthetic surgery, as procedures initially designed for reconstruction began to be adapted for cosmetic purposes. The Hollywood film industry also played a crucial role in popularizing aesthetic enhancements, as the pursuit of youthful and flawless appearances became more widespread. Facelifts, first performed in the early 1900s, became increasingly sophisticated, offering patients the opportunity to reduce visible signs of aging. The introduction of silicone as a material for implants, particularly in breast augmentation, marked another significant milestone. By the 1960s, silicone breast implants had been developed, although initial experimentation began earlier in the century. Non-surgical treatments also saw early developments with the use of chemical peels derived from phenol to improve skin texture and reduce wrinkles. Overall, the early 20th century set the stage for the rapid growth and specialization of the aesthetic medicine field, blending reconstructive surgery with cosmetic enhancements and establishing the foundations for modern practices. The late 20th century witnessed a dramatic expansion and refinement of aesthetic medicine, driven by technological advancements and a growing societal acceptance of cosmetic procedures. This period saw the rise of non-invasive treatments, which became increasingly popular due to their effectiveness and minimal downtime. The introduction of laser technology in the 1980s revolutionized the field, with laser resurfacing becoming a go-to method for treating skin imperfections like wrinkles, scars, and pigmentation. Concurrently, the development of liposuction in the 1970s by Dr. Yves Girard-Illouz gained widespread popularity in the 1980s, offering a novel way to contour the body by removing excess fat. The approval of Botox for cosmetic use by the FDA in 2002 marked a significant milestone, even though its aesthetic applications began in the late 1980s. Botox became a cornerstone of non-surgical facial rejuvenation used to reduce wrinkles and fine lines. Additionally, the late 20th century saw the refinement of breast augmentation procedures with the introduction of safer silicone implants and the standardization of techniques to achieve more natural results. Dermal fillers, made from substances like hyaluronic acid, also emerged during this time, providing a non-surgical option for enhancing facial volume and smoothing wrinkles. The integration of these innovations established the foundation for the diverse and sophisticated range of treatments available in modern aesthetic medicine, making beauty enhancement more accessible and socially accepted. The 21st century has been a period of remarkable innovation and growth in the field of aesthetic medicine, characterized by the rapid development of advanced technologies and a shift toward minimally invasive procedures. One of the most significant trends has been the rise of injectables, such as Botox and dermal fillers made from hyaluronic acid, which have become staples for facial rejuvenation by reducing wrinkles, restoring volume, and enhancing facial contours without the need for surgery. The introduction of next-generation laser and energy-based devices has further transformed aesthetic treatments, enabling precise skin resurfacing, hair removal, and the treatment of pigmentation with minimal recovery time. Body contouring technologies such as CoolSculpting, cryolipolysis, and Emsculpt, high-intensity focused electromagnetic technology, offer non-invasive options for fat reduction and muscle toning, catering to the growing demand for procedures with no downtime. Additionally, advancements in personalized medicine have led to the development of treatments tailored to individual genetic profiles, improving outcomes in skincare and anti-aging therapies. The integration of artificial intelligence, AI, in diagnostics and treatment planning has also begun to play a role, allowing for more accurate and customized treatment protocols. The focus on natural and subtle results has driven the popularity of thread lifts, which offer a non-surgical alternative to facelifts by using dissolvable sutures to lift and tighten the skin. The field has also seen a growing emphasis on sustainability and ethical practices, with increased demand for eco-friendly products and transparency in the sourcing of ingredients. Overall, the 21st century has ushered in a new era of aesthetic medicine, where cutting-edge technology, personalized care, and a holistic approach to beauty and wellness are at the forefront.